These three movements I'm going to take you through in this video are things I've been using in practice over the last 18 months, and they're surprisingly good for freeing up movement restriction and reducing pain, especially when doing them somewhat regularly, as I have been, showing people them a few times a day and doing the movements with them. The first two are fairly simple. The last is a little more complicated, but I've found it does things no other stretch does. All three collected together are pretty amazing bang for your buck in terms of getting movement into all your nerves everywhere, and especially the nerves around your trunk and hips, which is stuff I just couldn't find in the available texts and resources on neurodynamic movement. Feels a bit weird that nobody else seems to have thought about this stuff in quite the same way before, and that I've come up with something new. I just wanted to figure out simple ways of working on restriction in trunk movement, especially in the thoracic portion, as I started realizing that was quite often the result of limited movement of the peripheral nerves that arise there and run around into the tissues all around your ribcage. I've been working with cutaneous nerves in the layers of skin over the last 5 years, and these movements are based on getting more movement into those nerves particularly. So maybe that's a partial explanation. Working with cutaneous nerves is a pretty new concept in manual therapy, and it's naturally kind of new to really think of ways about moving them. There will be other videos for cutaneous nerves to come, but I guess this collection of the three movements here are something like a movement tonic for the body, doing them regularly, a few times a day, a few days a week, for instance. Some of what follows here gets a bit technical, but just know that you don't need to understand the anatomy and physiology for it to work. So long as you get that moving slowly and gently and going just to tension is a far better way of changing things than pushing into pain and holding big deep stretches, as much as that might seem like what needs to happen when things are really stuck. Moving nerves is termed neurodynamics. Like many neurodynamic movements, these involve a fair degree of lengthening, and you do need to be careful about that because nerves are always under tension and they are always exhibiting intraneural pressure, which is higher pressure inside. Lengthening nerves increases that intraneural pressure and increases neural tension. Your body keeps close track of those things, and your body getting worried about those increases in pressure and tension is actually quite often a significant factor in movement restriction and painful movement. So changing that through neurodynamics can be a great tool to address problem movements. I have seen people mess themselves up by being too keen with these movements, and I know from personal experience that while increasing neural mobility is really helpful, more movement and less restriction will occasionally mean you find something new gets cranky that you just didn't even know was a problem until being able to move more in certain directions. If these movements are different to how you move your body and your nerves in day-to-day life, and these movements will be different if you're doing them as described, you can do yourself some mischief. So start slowly with small movements, particularly if you are currently in pain, and especially if this is recent onset acute pain. The general premise with neurodynamics is that taking nerves gently into tension and then back out, and gently into tension and back out, helps the central nervous system, the brain and spinal cord, adapt and react less to what the nerves are reporting, while gently mobilizing and moving parts of the peripheral nervous system out in the body with helpful changes to blood flow inside the nerves. It's pretty cool that these gentle movements will result in healthier, less crabby nerves in the body that allow more movement and can sort of calm the nervous system as a whole. Too much stretch on a nerve for too long will cut down the blood supply into the nerve quite a lot and bring about a lack of oxygen in nerve tissues, which is a common problem in things like numbness and pins and needles. These movements do take nerves close to the end of what they're happy with. We are definitely going far enough to cut down that blood supply, and that's an okay thing for the short periods that we're there for the payoff of more movement afterwards. So you're not pushing into end range, and you're certainly not camping out there. It's just a second to end range at most. This first movement I've found to be particularly useful for lower back pain, especially unilateral or one-sided lower back pain, some hip pain, hip restriction, mid and upper back restriction, and also shoulder girdle problems, which when you go looking for it do seem to have involvement of portions of the intercostal nerves in a surprising number of cases. For the geeks, we are moving the intercostal and intercosto-abdominal nerves, parts of the lumbar plexus that run over the hips into the layers of skin, and also the nerves that they form into the front of the thigh. If you have back pain on one side, middle, lower, upper, sometimes it sucks going towards that side. Sometimes it sucks going the other way. You want to go whichever way feels nice, rather than pushing into painful movement, which isn't a great way to get your nerves on side. Going to start by taking your feet out a fair bit wider than shoulder distance here, and that's because if you're standing too slim, it is quite easy to limit movement as you start getting outside of your center of gravity, or to start swinging the hips across to each side. And yes, that is moving nerves, but we're trying to get movement into nerves a little higher up in the thoracic portion here as well. So starting with your feet out a little wider than shoulder distance just gives you a stable base of support so you can lean a fair way to either side. From here, you're going to drop your head across towards one side, nice and slow, reaching hand down the outside of your thigh, stacking from the bottom so your head comes up last. Same thing going to the other side, dropping your head across, reach an arm down your side, stacking from the bottom again so your head comes up last. I'm not saying that reaching down is a bad idea, but sometimes that does feel a little bit cranky, and putting length into the system is a much better idea overall. So from here, you're going to float your head up nice and long, going up with that ear, and with the first rib, and the second rib, and the third one, and the fourth one. And so you're kind of reaching up and out towards the line of the wall and the ceiling more than you are reaching down your side. Same thing to the other side, taking the head and neck up nice and long, lifting that ear, and the top rib, and the next one, and the next one, and the next one, going up and out towards the other side. It can be quite useful to get a little more tension into the upper portion of the thoracic cord as well. If you bring your fingertips up against your temples, that adds a little bit of tension into the intercostobrachial nerve, which arises from T2, sometimes T3, T4, and T5 as well. Same movement from here, going nice and long through your head and neck, lifting your ear, lifting the top rib, and the next one, and the next one, and the next one. And you can probably see I have a fair limitation in that movement due to that extra tension coming in from that upper portion of the thoracic spinal cord. If we have been assessing and addressing rib issues in clinic, we may well have talked about this next bit here. You're going to take the fleshy thenar eminence, the fleshy pad by your thumb there, find the cranky rib attachment at the front here, and as you're doing this movement, you're going to take that pressure towards that side. You're not actually moving your hand, I'm just moving my hand so you can see the direction you're heading in from there. Fingers up against your temples, and then from there, taking yourself up nice and long, lifting ear, lifting the top rib, and the next one, and the next one, and just a little bit of pressure with your hand, pressing straight towards the outside, and relaxed. And again, as you get to the end of the movement, pressing across with your hand, and relaxed. When I was talking about pain on one side before, if you've got pain on one side, and it sucks going to that side, first of all, just start out by doing movements towards the other side, and once you've done a few of those, you'll probably find you start gaining a little more mobility to the other side. So keep on moving to the other side, and now you can start moving a little to both sides, and you'll be able to go further and further towards the side that's painful. Same thing applies. If it's cranky going away from the side of pain, you first of all want to move towards, and just move in a comfortable range, trying little movements for a start. And as you get further and further across to that side, what you will often find is that when you come back to try movement towards the other side, it's not quite so cranky. So then you can start doing a little movement to that side, take yourself all the way across one way, just a little movement to the edge of pain going the other way. And with time and repeated repetitions, you should feel like you get a little further and a little further and a little further. Doing 10 or 15 of these movements in each session is quite helpful, and this is essentially something you can do as many times a day as you like. Maybe not 20 times a day, but you could theoretically do these 5, 6, 7, 8, 9, 10 times a day and feel positive changes in neural mobility as a result of that. The second movement takes us between extension and flexion. I like the effects on the nerves around the chest specifically, but this also brings about movement of nerves lower down the trunk as well as the lower back and legs. There's not really much in modern life that takes us into thoracic extension. And certainly not on a daily basis unless you're doing a hell of a lot of yoga, or you're teaching yoga, or you're painting or plastering ceilings for a living, and I can't say I recommend that one especially. Because we don't really move that way, stuff through the front of the body gets a bit bunged up with all the sitting and the looking down and the stress, all the flexion that modern life takes us into. Firstly, we're going into extension combined with turning the thumbs out and opening the chest and the shoulders. For the geeks, that's addressing the intercostal nerves between the ribs and the supraclavicular nerves, which spread around your shoulders a little bit like a cape. The other end of the movement is probably a lot more familiar, and it's useful for lengthening a lot of the nerves through your back. Moving between comfortable extension and comfortable flexion gives a great amount of movement to the course of so many nerves. For the geeks, the extension phase draws the intercostal nerves forward while shortening and slackening the spinal cord, accommodating more of that drawing forwards. And then the flexion phase brings slack into the intercostal nerves while drawing tension into the spinal cord and drawing basically all of your nerves everywhere, backward and upward. This is why flexion and extension are part of so many neurodynamic movements. So we're moving between extension and flexion with this one. When I'm moving back into extension, I want to think about lifting my sternum as high as I can. So my neck is certainly going to come back as I lift my sternum, but I'm not scrunching my neck back into extension as part of that. Lifting sternum, taking a big breath in. I'm going to combine that with turning arms out both sides, which brings a little more tension across the chest and is helpful for those supraclavicular nerves. So good breath in, lifting my sternum as high as I can. Turning thumbs out. From there, breathing out, dropping my chin down to my chest, thumbs in towards myself, and just letting myself hang at the bottom of that movement. You're going to stack from the bottom with another breath in, turning arms out as you go. Lifting sternum nice and high. Breathing out, thumbs in towards yourself, letting your head hang, rolling all the way down to a comfortable position, starting that breath again from the bottom. It does seem for some people that this turns into big flowy yoga movements overhead. If you have a look at what's happening with my arms here, they are pretty much hanging from my sockets. I'm just thinking about turning my arms in and out. My arms do come out from the sides of my body as I'm going back into extension a little bit, and that's just because I'm trying to turn my thumbs back as much as possible. I'm not bringing my arms way back there. It's just that movement of trying to turn your thumbs back as far as you can. When you're moving down into flexion, if you find you can only get so far before things start feeling crabby somewhere, just move to where's comfortable, coming up again from that position, and keep moving into extension, because that's the bit that will help to mobilize a whole lot of stuff through the front of the body and give some of your nerves through the spine a little more room. This final movement is the one that's more complicated than I'd like, but it does seem like each little component is quite important to get the good effects it can produce. I've found it particularly useful when hip extension is a problem. It seems very relieving for a bunch of patients I've had with pain around the back of the hip and down the back of the leg, because it gives so much freedom to nerves on the opposite side around the front of the hip. Again, that's a part of the body that gets pretty bunged up with all the sitting in modern life, and that quad and hip flexor stretches just don't address all that well. So again, for the geeks, this movement brings tension into the lumbar plexus, running to the skin over the hips and forming the femoral bundle, supplying all the tissues down the front of the thigh. We are mobilizing the whole of the lumbar plexus, the obturator and ilioinguinal nerve, the cutaneous branch of the genitofemoral nerve, the femoral bundle and anterior and medial femoral cutaneous nerves, the lateral femoral cutaneous nerve, and that one gets bunged up more frequently than just about any other nerve. I spend a lot of time working there. Then the subcostal, lateral branch of the iliohypogastric and superior cluneal nerves. For this last one, you need yourself a chair, or a couch will work as well. If you're using a chair, it does need to be lower than your knee, so you can kneel down onto it. If chairs are too high in your house, use the couch. Swivel chairs, office chairs are no good for this really. You want something reasonably supportive. I'm going to step forward with the other leg. You can see my hip is still pretty much straight over where my knee is. From here, Using some posterior pelvic tilt, tucking my tailbone under, I can feel a little bit of tension in front of my thigh there for a start. I'm going to place my hand on the back of the chair or on the arm of the couch for a little bit of support. Drop my chin down to my chest, rolling forwards from there. And very quickly I'd get to a point where I just won't roll forwards any further. I can try and pull myself further forwards, but I'm fighting into more and more tension in the front of my thigh here, because although I'm shortening in the front of my body, I'm bringing in a whole lot more tension from the spinal cord. If I let go of that posterior pelvic tilt, I can roll a whole lot further there, and I don't really feel tension in the front of my thigh. So, very important, tucking tailbone under, drop the chin down to your chest, rolling forwards from there, keeping your knee over your hip. It is tempting, it seems, for some people, especially if they're used to stretching a lot through the front of their thigh and their hip flexors, to lunge out further in front. As soon as you get in the hip out in front of the knee, you're starting to tense the nerves as they run up further above the hip, the rest of the lumbar plexus as it runs towards the spine from there. And you don't want to do that, because that's really going to limit the amount of movement side to side that we want to get with this. Tucking tailbone, rolling forwards, and then from here, taking up all the way across towards one side, all the way across towards the other side, and you're gliding back and forth between those two positions. My upper body is swinging from side to side to accommodate that movement, and that is varying the tension through the spinal cord and through the lumbar plexus above the hip, and mobilizing all of those nerves above the hip quite differently, as well as mobilizing things further down that femoral bundle in the front of the thigh, and all those cutaneous nerves around the lateral hip. If I turn 90 degrees here so you can see what I'm doing from the back. One knee onto the chair, stepping forward, hip above knee, tuck your tailbone, hand on the arm of the couch or arm of the back of the chair, chin to your chest, rolling forwards, hip out to one side, going to the other side, letting your torso roll back and forth to either side. It does seem for some people this turns into driving the movement from their torso, and yes, that is moving nerves, but I really don't feel the same effect from that as I do if I really think about generating most of the movement from the pelvis, from the hips sliding either side. Another one I've picked up recently is people swinging around the hip in rotation. And yes, again, that is moving nerves, but you really want to think about moving straight to each side for the enhanced tension that brings into all of those neural structures.